Hey there, and welcome to This Explainer. Look, if you've recently been sitting in a dentist's chair in Nallakunta, or really anywhere else in Hyderabad, and your dentist recommended something called a DMLS crown, well, there's a very good chance you left that appointment feeling a little anxious. And you know what? It is completely normal to feel confused by all that medical jargon. But don't worry, because today we're going to clear all of that up and give you the confidence you need to make the right choice for your smile.
Okay, I know exactly what you're thinking right now. You're wondering, what on earth is a DMLS crown, and why is it going in my mouth, right? It sounds incredibly technical, maybe even a bit intimidating, but it's actually a totally brilliant piece of modern technology.
So let's dive into what this actually means. DMLS stands for Direct Metal Laser Sintering. When I first looked into this, what really surprised me is that DMLS isn't a brand name at all. It's a cutting-edge manufacturing process. Just imagine incredibly fine metal powder, usually this really strong cobalt-chromium alloy, being fused together, literally layer by a high-precision laser. And the whole thing is guided by a perfect digital 3D design of your actual tooth. It's basically dentistry meeting high-tech engineering.
Here is our game plan for today. 1. Demystifying DMLS technology. 2. Why choose DMLS crowns? 3. Comparing your crown options. 4. The step-by-step process. And finally, number 5. Lifespan and aftercare.
All right, let's jump right into Section 1, Demystifying DMLS Technology. 3D printed in metal. Honestly, that is absolutely the best way to think about DMLS. Back in the day, dentists had to use these older wax molds and do manual casting to shape metal crowns. And, that old process always left just a little bit of room for human error. But this digital layer-by-layer DMLS method, it creates an incredibly tight, highly accurate fit. It is essentially 3D printing a custom suit of armor for your tooth.
Here's how it physically comes together. It starts out with a digital 3D design of your tooth. Then, that superfine cobalt-chromium metal powder is fused by the laser. But here is an absolutely crucial detail. While the base framework is made of this incredibly strong metal, you don't actually have to walk around with a metal-colored tooth. Dentists will typically layer porcelain or ceramic right over that metal base, so the final result looks exactly like your natural tooth. Best of both worlds, right?
Moving right along to Section 2, why choose DMLS crowns? Let's talk benefits.
Because this digital scanning and laser sintering process pretty much eliminates human error, you get a superior precision fit with minimal gaps. And why does that matter to you? Well, a tighter fit means bacteria simply cannot seep underneath the crown. That directly protects your underlying tooth from future decay, which gives the crown way better longevity. Plus, the layer-by-layer fusion makes the framework incredibly dense and strong, making it highly accurate for multi-tooth bridges. And on top of all that, it's generally more cost-effective than those premium all-ceramic or full zirconia options. It's a real win-win.
The battle of front teeth versus back molars really illustrates where DMLS shines. You see, your front teeth are all about aesthetics. When you smile, you want maximum natural translucency. But your back molars? Those guys are the workhorses of your mouth. They handle immense, heavy chewing pressure. So, while zirconia might be the go-to for your front teeth, the sheer strength and dense metal framework of a DMLS crown makes it an absolute powerhouse for those back molars.
So, are you an ideal candidate? Well, you might be if you have a badly decayed tooth, or maybe one that's been weakened by a root canal. If you need a super durable option for those heavy chewing back teeth, or a really precise multi-unit bridge, this is for sure the way to go. It's also perfect if you're looking for that sweet spot between durability and affordability, or, and this is a big one, if you've ever suffered from an ill-fitting crown in the past and want perfect accuracy this time around. If you fit any of these profiles, your dentist recommendation is totally spot on for your needs.
Section 3. Comparing your crown options. Let's see how DMLS stacks up against Zirconia and PFM.
When we put the facts side by side, the whole story becomes really clear. Notice the fit accuracy. Both DMLS and Zirconia are very high because they are digitally designed, whereas traditional PFM is only moderate. When it comes to aesthetics, Zirconia takes the crown, pun absolutely intended, making it excellent for front teeth. But check out the best for and relative cost factors. DMLS offers phenomenal strength for molars and bridges at a moderate cost. It truly offers the best value to strength ratio for the back of your mouth, while Zirconia remains your premium aesthetic choice for the front. Okay, Section 4, the step-by-step process. Let's talk about what to expect in the chair.
And that brings us to the elephant in the room. Is the procedure painful? Let's just address this head on.
This is a very real fear and genuinely the #1 thing people worry about before getting a crown. Your anxiety here? Completely valid.
But here is the reassuring truth. With modern local anesthesia and today's advanced techniques, preparing your tooth for a crown is largely comfortable. You're not going to be in agony during the procedure. Actually, scratch that. You might even catch yourself dozing off in the chair. Now, it's completely normal to experience a little bit of mild sensitivity for a day or two afterward, but that is easily managed with some basic pain relief advised by your dentist.
Let's walk through your actual treatment roadmap. Step 1 is your consultation and digital X-ray. Step 2 is the tooth preparation, where they gently shape it to make room. Step 3 is a literal game changer, the digital impression. Say goodbye to those messy, gag-inducing old putty impressions. So many clinics now use a quick, super comfortable intraoral scanner. Step 4 is the lab using that laser sintering we talked about to build your crown. Step 5 gives you a temporary crown for protection. And Step 6 is the final fitting and cementation. This whole shebang usually just takes 1 to 2 visits spread out over a week or so. It is remarkably efficient.
Finally, Section 5, Lifespan and Aftercare, How to Protect Your Investment.
15. Now that is a pretty fantastic number, right? Because with the proper oral hygiene and regular dental checkups, a DMLS crown can comfortably last 8 to 15 years, and sometimes even longer than that.
But reaching that 15-year mark, that's a team effort. The DMLS technology provides the structural strength, but you've got to provide the daily maintenance. You need to brush twice daily with a soft brush and floss gently around the crown margin to prevent plaque buildup. And you absolutely must avoid biting hard objects like ice, as tempting as that can be in the Hyderabad heat, I know. Also, if you grind your teeth, please wear a night guard. And of course, keep visiting your dentist every 6 months.
Let's bring this right back home. The technology is incredible, for sure, but it is only as good as the dental team utilizing it. If you live in or around Nallakunta, finding the right clinic makes a massive difference. Patients from nearby localities like Didi Colony, Barkatpura, Adikmet, and Vidyanagar have fantastic connectivity that top-tier specialists right in the Nallakunta area who offer these digital solutions all under one roof.
To empower you, here's a really practical checklist for choosing your local clinic. Look for a team experienced in prosthodontics. Ensure they have those in-house digital scanning tools we talked about. They should have completely transparent cost discussions up front, no hidden fees. Nobody likes those. Look for positive patient reviews and a highly sterilized, hygienic setup. Remember, you have the right to advocate for your own standard of care, so don't settle for less.
So, here's my final question for you. Are you ready to restore your tooth with confidence rather than anxiety? DMLS is proof that dentistry isn't just about fixing teeth anymore. It's about high-tech precision engineering. So ask yourself, when you sit in that chair, are you settling for yesterday's techniques, or are you ready to ask your dentist for the 3D printed future of your smile?